Chapter 13: Schizophrenia Spectrum and Other Psychotic Disorders. This is a summary of Barlow and Durand's 7th edition Abnormal Psychology textbook, An Integrative Approach. To begin with, schizophrenia is a broad spectrum of disorders characterized by cognitive and emotional dysfunctions that include delusions, hallucinations, disorganized speech and behavior, as well as inappropriate emotions and withdrawal, social withdrawal. In 1899, Emil Kraepelin combined separate disorders with shared similar underlying features. This was known as dementia praecox. It was used to distinguish against another disorder, which was called manic depressive illness, that is now called bipolar disorder. Some symptoms of schizophrenia include catatonia, which is alternating immobility and excited agitation. There is also hebephrenia, which is silly and immature emotionality. And finally, there's also paranoia, which is delusions of grandeur or persecution. Associative splitting. Bleuler in 1908 coined schizophrenia, or split mind from Greek. And it was due to breaks in associative trend in personality. But this is not to be confused with what is now known as split personality or dissociative identity disorder. Psychotic behaviors. Schizophrenia is characterized by unusual behaviors like delusions, hallucinations. They make up what is known as positive symptoms. Delusions are disorders of thought content, whereby individuals believe they are famous or important people, grandeur, or are being persecuted, etc. Erotomania is an example of a delusional belief, whereby they believe that a famous person is in love with them. Hallucinations are experiences of any sensory input without any input from the surrounding environment. Negative symptoms. This is the absence or insufficiency of normal behavior and includes apathy, limited thought, speech, as well as emotional and social withdrawal. Avolition. This is the inability to initiate and persist in activity, showing little interest for basic day-to-day function. Alogia is the relative absence of speech, whereby individuals respond to questions with brief replies that have little content and they appear uninterested in conversation. And hedonia is the lack of pleasurable experiences in the individual, whereby they don't usually enjoy activities like eating, social interaction, sex. Affective flattening is when individuals communicate without showing emotional reactions. Inappropriate affect. This is when individuals laugh, cry, or spur out other emotions in improper times. They act out bizarrely in public. Catatonic immobility is waxy flexibility, whereby it is the tendency to keep their bodies and limbs in the position they are put in by someone else, like a wax doll, for example, wax model. Historic schizophrenia subtypes. The DSM-4 used to classify symptoms as either being paranoid, disorganized, and or catatonic, but this form of classification was dropped since symptoms can change over the course of the schizophrenic illness. Schizophreniform disorder. The symptoms sometimes disappear as a result of successful treatment, but they often do so for reasons completely unknown. Schizoaffective disorders. This is when people have symptoms of schizophrenia and have mood disorders. They also tend not to get better on their own accord, so they require treatment. Delusional disorders. This is the persistent belief that is contrary to reality in the absence of other characteristics of schizophrenia, whereby they believe in a certain delusion. Shared psychotic disorder, folie et deux, is when an individual develops delusions resulting from a close relationship with a deluded individual. Substance-induced psychotic disorder. This is the gaining of psychosis from substance abuse. Brief psychotic disorder. The presence of one or more positive symptoms such as delusions, hallucinations, or disorganized speech or behavior last about a month or even less. Attenuated psychosis syndrome. This is when individuals begin to develop hallucinations or delusions and psychotic symptoms, and they are sufficiently distressed to seek help. Seeking early intervention can improve the rate of treatment for people with this disorder. Prodromal stage is a 1 to 2 year period before serious symptoms occur. It is less severe, but the behaviors exhibited are still unusual. The dopamine theory. It is believed that schizophrenia is caused by excess stimulation of dopamine D2 receptors, according to Harrison 2012, and it affects the striatum and basal ganglia. Also, there's a deficiency in stimulation of D1 receptors in the prefrontal area. So too much stimulation in D2 and too little stimulation in D1 of certain specific regions in the brain may be the cause of schizophrenia, whether it be the positive or negative symptoms. The schizophrenogenic mother. It is believed that a schizophrenogenic mother is a mother with cold, dominant, and rejecting nature, and this was thought to cause schizophrenia in children, according to From Reichman in 1948. The double-blind communication portrayed a communication style that produced conflict, thought to cause schizophrenia in the aforementioned schizophrenogenic mother, whereas in causing schizophrenia towards her children. Expressed emotion is a focused particular emotional communication in the family, which is used by researchers to assess the possibility of relapse back to schizophrenia. Treatment. Schizophrenia is treated through electroconvulsive therapy, neuroleptics, and antipsychotics. A token economy is used to handle non-compliance in patients to condition their behaviors to what is acceptable. So in summary, we looked at schizophrenia. We looked at Emil Kraepelin in his creation of the term dementia praecox. We also looked at symptoms of schizophrenia like catatonia, hebephrenia, paranoia, associative splitting, psychotic behavior, delusion, erotomania, hallucination, negative symptoms, avolition, alogia, anhedonia, affective flattening, inappropriate affect, catatonic immobility, historic schizophrenia subtypes. We looked at categories of schizophrenia like schizophreniform disorder, schizoaffective disorders, delusional disorders, shared psychotic disorders like folie et deux, substance-induced psychotic disorders, brief psychotic disorders, attenuated psychosis syndrome, prodromal stage. And we also looked at causes or potential causes of schizophrenia like dopamine theory, the schizophrenogenic mother, double-blind communication, expressed emotion, and we finally looked at treatments like electroconvulsive therapy, neuroleptics, antipsychotics, and the token economy. So thank you for watching. Bye-bye.